predau de fapt microfonul doamnei profesor dr. Cătălina Arsenescu, care este președinta Societății Române de Reabilitare Generală și Orală. Doamnă profesor, vă predau microfonul.
Da. Vă mulțumesc foarte mult. Stimați colegi, eu mă simt onorată să încep eu cu moderarea primei sesiuni a acestui congres prestigios. După cum se poate observa, este vorba de o sesiune multidisciplinară în care cardiologul a fost pus la mijloc. Poate întâmplător, poate nu întâmplător, poate că este nevoie totdeauna de un cardiolog la mijloc. Stimați colegi, am deosebită onoare să invit pentru prima conferință pe președintele Societății Internaționale de Reabilitare Orală, cu care deja ne-am familiarizat și care trebuie să recunosc că în culise am aflat mici detalii, că domnul profesor are multiple ocazii și multiple bucurii să participe la acest congres, pentru că zona României este foarte apropiată și, în mod particular, aș putea spune Bucovina. E adevărat, domnule profesor? Cu mare plăcere vă invităm și vă ascultăm.
Doamna președinte, stimați colegi, eu am un privilegiu să-l introduc pe unul din colaboratorii mei, care este doctorul Chervet. Doctorul Chervet este o personalitate. Noi lucrăm împreună de mulți ani de zile și ceea ce îl interesează și ceea ce interesează cardiologia este chelația sângelui pe care el îl practică cu o deosebite cunoștințe și cu multă perseverență. Doctorul Chervet este un imunotoxicolog și ceea ce îl interesează este o mare parte din ceea ce fac eu zilnic, deci procesul utilizării aliajelor metalice. Noi suntem adversari acestor materiale și cauza o veți vedea după câteva minute, dar doctorul Chervet, cu calitățile pe care el are și bunăvoința care a avut-o să vie aici, este de acum un mare lucru, căci el nu are niciodată timp să vie. I-a promis că România nu este o țară, România este o inimă și el a acceptat să vie, să penetreze puțin o țară în inima noastră românească. Deci eu îl invit cu autorizarea dumitale pe domnul doctor Chervet, care va susține această teză de o importanță capitală pentru noi. Am spus înainte, noi vom medicaliza și în puțin stomatologia, îi vom da lucruri care merită, ne vom separa puțin de concepții pe care le-am avut în trecut și dăm acum o imagine mai pozitivă acestei medicini pe care o practicăm de acum, de mulți ani de zile, bineînțeles, dar el va fi emisarul acestei noi tehnologii. Deci, dau cuvântul domnului doctor Chervet.
Mrs. President, dear professors, dear colleagues, dear friends, First of all, I would like to thank very much Professor Sandhaus to have introduced me with such full of praise words. I have the honor to be his friend and to work with him. And I can promise you it's a real privilege. Then I would like to thank also the organizers of this great event who have invited me in your wonderful country, Romania, to give you some information about chemotherapy. As you have remarked, English is not my mother tongue. Nevertheless, I will try to speak this language, and I hope you will understand me. And now I will give you the menu of this short presentation, which would need much and much more time because it's a huge subject. So in the menu, as starter, we'll have a short definition and history of chemotherapy. Then we'll speak about the main chelators, and in the third point, the environmental toxic metals, which are the base of the pollution of our Earth. Then we'll see some view of our clinic, then some clinical cases, and to finish the conclusions. So now, chemotherapy. So definition. Chemotherapy is a treatment by the chele. Chele in Greek means the crab claw. A chelator is a product that grabs the heavy metals like the crab claw and facilitates their expression, particularly via the urinary tract. The most well-known chelator is the hemoglobin with an ion of iron in the center. Now a small history. In 1893, Alfred Werner, a Swiss scientist, found a revolutionary concept of a linking chemical structure with a metallic ion in the center of an octahedral structure in the ring. In 1920, Morgan and Drew proposed the word chelation to define the action of a heterocyclic structure grabbing the metal like a crab claw. The leucite, a combination of acetylene and arsenic trichloride, was discovered by Julius Arthur Müller in 1904. During the war, the German army has had the project to use this toxic against the Allied troops. Its antidote, the British anti-leucite, the BAL, was synthesized at Oxford University in 1940. It's still very well known and still used as a very good chelator for arsenic. Following that, the chemical industry developed other chelators. Now, the main chelator. First, the NPS, 2,3-sulfaning propan S-sulfonic acid, one of the most used in injection and orally. It does not pass the hematoencephalic barrier. It chelates the mercury, aluminum, cadmium, arsenic, nickel, palladium, platinum, silver, cadmium, tin, zinc, and copper. There is no particular side effect at the recommended dosage. Exception 5% of dermatologic allergies. The second main chelator is the zinc DTPA, diethylene triamine pentaacetic acid. This chelator complex many metals and potentiates the effect of the DMPS. For the provocation test, we use zinc DTPA plus DMPS, which will chelate the heavy metals contained in the body of the patient and let them pass in the urine. The urine is then sent to the microtrace lab in Germany, where the amounts of the different metals are measured. The third main chelator is DMSA, dimercaptosuccinic acid. It is a specific chelator of mercury, a little bit less of arsenic and lead. One advantage of this chelator that it passes the hematoencephalic barrier. It's also an inconvenience because of its potential role as a garbage truck. By transporting chelated heavy metals through the hematoencephalic barrier and exchanging them with local metals for which it has more affinity. We have seen some cases of aggravation due to this garbage truck phenomenon. In this condition, it is very important to begin a therapy with articulators which do not pass the hematoencephalic barrier. I give this precision as I know that some doctors use only the DMSA as a chelator. The fourth chelator is EDTA, ethyldiamine tetraacetic acid. And last but not the least, it is the most used chelator in the world. It is a specific chelator for lead, cadmium, and calcium. It is commonly used in hospital as therapy for lead intoxication. We call it Sandhaus. EDTA effect. It slackens the vessel's wall also by the adjunction of magnesium in the perfusion. It chelates the intravascular calcium, which augments the blood pressure and calcifies the vessels. Also, it reduces the free radicals, particularly the free iron and copper ions, which dramatically accelerate the lipid peroxidation. It reduces also the platelet aggregation and therefore the coagulation. The addition of all these effects improve a lot all the vascular tree. It's very important to remind you that the length of the vascular tree is around 100,000 kilometers. It means twice the Earth's circumference with 5 billion of kilometers, of capillaries, Certain cardiovascular surgeons, like Professor von der Schaaf, president of the International Board for Clinical Mental environmental pollution is a real peril for the health of the whole planet. The pollution is completely or largely responsible for the induction of a major part of cancer. The heavy metals, even in a very low dosage, have a carcinogenic and genotoxic role. The arsenic, beryllium, the cadmium, nickel, the hexavalent chrome, see the film Erin Brockovich with Julia Roberts, generate very clearly different types of cancers. Toxic metals provoke oxidant damages on the DNA, a major drop of the glutathione, a major drop in the level of superoxide dismutase, SOD. These two last substances are major antioxidant enzymes. Also, it creates a blockage of the repairing mechanism of the DNA. The main toxic metals we find in the urine of the patient after chelation are mercury, arsenic, aluminium, silver, tin, nickel, lead, copper, and titanium. The most toxic of all above, which is also the most important part of the tooth fillings, is mercury. Symbol Hj, from the ancient name of quicksilver, which was called R0. Mercury is liquid at room temperature. Mercury is easily absorbed in the central nervous system, CNS. Mercury generates major problems in the CNS, like neuronal destruction and paralysis. The tooth fillings are the main source of mercury intoxication. During the pause and especially the removal of tooth fillings, the vapors of mercury are liberated and reabsorbed by the neighboring tissues and by the blood. The tooth fillings weighs between 1.5 and 2 grams and contains 50% of mercury, 35% of silver, 13% of tin, and 2% of copper. Mercury and the hematoencephalic virus. Mercury is passing very easily the hematoencephalic barrier and provokes heavy damages. Severe neurological illnesses like multiple sclerosis have been described after removal of tooth fillings without precaution. In France, certain types of brain tumors are considered as professional illnesses for the dentist. Mercury and the placental barrier. Mercury is passing also very easily another barrier, which is the placental barrier. This one should protect the foetus, but Mother Nature has not claimed that it should filter also heavy metals. In this condition, if the mother is intoxicated by mercury, we will find it again in the newborns, and some could develop an allergy to mercury. These babies with receive a vaccination containing mercury, a huge immune reaction can develop, a major encephalitis, for example. That can cause autism. There was no autism before the vaccination. In the population who are not at all vaccinated, like the Amish, there are no cases of autism. There are cases of children which became autistic after MMR vaccination, mumps, measles, and rubella. And these facts were recognized by courts of law. The pharmaceutical company shall pay for these children and their families very important compensation. The main symptoms observed in patients who consult us are chronic fatigue syndrome, SFC, fibromyalgia, concentration troubles, confusions, loss of memory. Also electrosensitivity that gives anxiety, faintness, nausea. There's also neurological illnesses like Alzheimer's, Parkinson, and multiple sclerosis, and also naturally cancer. Two remarkable books were written on this subject by Françoise Camberac. First is The Truth About the Emerging Illnesses, and second is Emerging Illnesses, How to Cope with Them. Elimination of heavy metals. For that we need a session of chemotherapy to know which metals are intoxicating the patient and which are the amounts of the different toxins. The second point is the removal of the tooth fillings by the dentist. We will see that with Professor Sandhaus. What is very important is that the chelation is indispensable as quick as possible, the same day as possible, after a tooth filling removal, in order to chelate as rapidly as possible the vaporized metals. I will have a small use of our clinic. You see the gray side, so we give the chelation with our nurses and also the dental department where work Professor Sandhaus. In our clinic, called Swiss Medical Detox, we have 15 chairs. We give treatment by injection and by infusion IV. The time for the treatment is between 1 and 2 hours. It depends on the type of the chelate. We have more or less 30 patients a day, so we give around 6,000 treatments a year. Now we see some cases, medical cases. The first case is the one of a woman, 60 years old, very depressed, treated with long psychiatric medication, with trouble of sleep and recurrent headaches. In 2004, she got a breast cancer. When we saw her in the clinic, she was quite desperate. She had a lot of tooth fillings. So we did the provocation test, pupil of Professor Sandhaus. In chemotherapy for 1 year, all the symptoms have disappeared. Depression has gone. She ceased all antidepressive medication. You will see the result of the last urine heavy metals measurement, the next slide, and we'll see that mercury fall down from 45 to 6.4, and also lead, but not so much. But it was sufficient to cure the patient. Case number 2 was a nurse born in 1977, so a young one. She had major concentration troubles. Her confusion was so important that she could not work anymore, and she was considered as invalid by the insurances. She had also a reactive anxiety and muscular shaking and a chronic fatigue syndrome, very strong. In the test of the microtrace mineral lab, we can see that the mercury was very high, it was 178.6. The tin also was quite high. Though the recurrence is not correct, it's less than 3 normally for the tin. Mercury was very high at 40.6 microgram by gram of graphene. Nickel was high also, lead, and also titanium. In this case, there was not so much to see. The pollution came probably from food or from pesticides. After 1.5 years of chelation, all the symptoms have disappeared, and the patient can work again at 100% before she was completely invalid. You will see in the next slide the dramatic fall of the heavy metals level in the urine. Arsenic fall down from more than 200 to 44. Tin also disappeared a lot. Mercury, nickel, lead, and titanium also. The case number 3, a man born in 1968. He suffered of very severe tinnitus, of fibromyalgia, of insomnia, ulcers of the mouth, iterative herpes, and chronic fatigue syndrome. After the provocation test, we have found very high amounts of mercury and arsenic. The arsenic is more than 200 microgram by gram of creatinine. Cadmium was high also. Mercury at more than 87, very high. Nickel more than 10, and lead at 38 microgram by gram of creatinine. fatigue syndrome, memory loss, dysesthesia, and electrosensitivity. After a provocation test, we have found moderate heavy metals levels, but we are not equal in front of the toxics. Mercury was quite high, but not so much, at 28.6 microgram of mercury for gram of creatinine. Nickel was high, lead not so much, and titan also at 60.4. After 1 year of classical chemotherapy by zinc and DMPS, followed by treatment with DMSA and then EDTA, the patient has almost no more pain. Before the treatment, she could even not climb the steps of her house. Now the tinnitus have decreased almost completely and her memory has improved a lot. In correlation, we will see that the toxic metals have also decreased. With mercury now at 9.1, nickel 6.4, and today 2.3. The last case, case 5. We will finish by one of the nicest cases we have treated with Professor Sandhaus. This is a patient born in 1942, who was desperate due to generalized eczema, which was resistant since years to any treatment. She also complains of chronic fatigue syndrome and cramps. All these symptoms appeared after dental treatments done without sufficient precautions. So also in this case the mercury was high with 50.18, lead with 24, and also TPA. After tooth filling removal, perfectly executed by Professor Sandhaus, and a 1 year long therapy, the symptoms have disappeared, and particularly the rubber eczema. She has now baby skin and she is really happy. We will see on the last result we will present a wonderful improvement of all the values of heavy metals. Mercury has fallen down to 6.8, lead and titanium also. Conclusion. These cases show well how useful chemotherapy can be. How can we cure an intoxicated, poisoned patient? We try to perform a medicine we call DOC, D-O-C. I mean, first detoxify, then optimize nutrition and immune system. They go very often together. And then we have to treat circulation by EDTA more particularly. Nature does the rest. I could not finish this presentation without quoting two great men. The first one said, "The nature in its limitless fecundity is a doctor steers alive, and it takes care, without saying a word, of their frequent was written by Antoine de Saint-Exupéry, the very known author of The Little Prince. Thank you very much for your attention.
Thank you very much for a very interesting conference. And there is some question or commentary, please.
One question. This presentation is in the context of the methods which are introduced in the body by the dentist, for example, fillings or other, or are the patient coming for a symptomatology with the fatigability, etc., as you present?
Yes, the patients are coming for the different symptoms we have mentioned before. But yes, in this condition we measure the heavy metals in the urine, as I presented you, and then we treat them. But we cannot certify that it comes only from the tooth fillings. It could come also from the food, or from the pesticides, and so on.
The main pollution are coming from the water, air, and the soil. American are developing the new concept of exposome. Professor Exposome, Professor Rappaport from LA, presented that our contamination during the beginning and through our life induce in the body a mechanism that we can, as you presented, diagnostic and treat. If you measure these levels are in connection with the level with the vitamin D3 in the serum as a predicting of the metabolism.
Yeah. Yes, we use a lot of antioxidants also. Glutathione, for example, with N-acetylcysteine to reduce the glutathione level. But also vitamin D is a very good antioxidant, as you know. So in correlation, it's difficult to say, but in any case, if you have a lot of oxidant in your body, so you use a lot the antioxidant, there should be a correlation between them. Probably, yes. But I haven't measured that.
Yes. Okay, thanks.
You're welcome.
Congratulations.
Thank you very much.
Another question, please. If not, thank you very much, Professor